In global health, we love products. Guidelines are developed, research results are published, tools are created, commodities are procured. We really love our products. And it makes sense, because products can lead to impact. Global guidelines can change policies at the highest levels. Evidence-based interventions in maternal-child health, grounded in research, has been shown to save millions of lives. Products are tangible. They can be measured. And what gets measured gets funded. And what gets funded is sustained. But today I want to talk about something a little bit different, something more quiet, less visible, but equally important. And that is process. Because process is how we get there. Process is how we build trust. Process is how we build and sustain communities to make sure that the products that are developed are actually used for impact. My name is Nandita Thatte, and I'm a technical officer at the World Health Organization based in Geneva, Switzerland. In my role, I lead a network of civil society organizations working in family planning and sexual and reproductive health and rights. I believe that investing in process, investing in network building, creating spaces, and ensuring that community engagement is prioritized is critical to ensuring that the products we develop reflect the lived realities of the communities we wish to serve. When I first started, I was invited to attend a research priority setting meeting. The topic was on family planning in humanitarian settings, a topic that had been identified by global partners and donors. Most of the participants were academics from North America or Europe, and there were some partners from international NGOs. I pushed the organizers to allow me to invite some of our civil society partners based in the region where the research was supposed to happen. During the discussions, I noticed that it was the international partners that were taking up a lot of the space and having a lot of the discussions. But finally, one of our local partners raised her hand from the back, and she said, increasing access to knowledge to contraception, that's not really relevant. Women in these settings, they know what injectable contraceptives are. They also know that injectables are what traffickers use and give to young girls before they're trafficked so they don't get pregnant. And then another woman, again from our civil society partner based locally, she raised her hand and she said, where I work, in an actual camp, pregnancy is protective because women believe that if they are visibly pregnant, they're less likely to be raped. We shifted the focus of that research after that. But imagine if those partners weren't involved in that process. What would have happened? It might have been another well-intentioned study, maybe even some publications. But chances are those results wouldn't have been relevant and probably never get used. And this is why I really believe process is just as important as product. Now, you're probably thinking, well, yeah, isn't that obvious? And it is obvious. But the truth is, in the global health community, we still don't do it. Donors, governments, even the private sector are more likely to fund the development of a guideline or a research protocol than they are to invest in process. They don't want to invest in building communities, creating spaces, and ensuring community engagement. It's difficult, it's messy, and it's hard to measure. But what does that mean for our results as a global health community? It means that guidelines continue to sit on shelves. It means that research results aren't being used. And it means that evidence-based interventions continue to not be scaled up or sustained. But investing in process isn't just good practice or the right thing to do. It's also about health equity. Because when products don't reflect the lived realities of the communities on the ground, or don't even reach those communities, it's the most marginalized that suffer the most. And nowhere is this more true than in sexual and reproductive health and rights. This is a topic that is deeply personal. It's cultural, and it's increasingly more political. But it's also a topic that affects literally every person on the planet, and this is why I'm so passionate about it. Investing in process in SRHR, whether it's through building networks, partnerships, or creating spaces for community engagement, is important for so many reasons, but I want to share just a few with you. First, as I mentioned earlier, it allows us to ensure that community needs and priorities are reflected in global guidelines and research. But these investments can also help address issues around misinformation or help us navigate sensitive topics like safe abortion or comprehensive sexuality education. Second, investing in process can provide valuable insights on how products can be disseminated and better used in communities. And this can mean things like making sure products are translated or available in languages other than English. Or it can mean working with communities to identify new ways of training that incorporate locally adapted cultural norms like storytelling, art, or theater. Finally, investing in process can help us ensure that programs last beyond the life of a project or a funding cycle. Earlier this year, we all witnessed what happened when global funding cuts came. It was shocking and it was sudden. But what's interesting is that it was the local civil society partners and the networks that they were part of that kept the work going. Why? It's not because they had funding. We all lost funding. But it's because they had invested in process. They had invested in building trust. They invested in their communities, connection, and were committed to doing the work, even in the absence of funding. In reflecting on my AFHE experience, I've been thinking about my product, the final project, and the process used to get me here. I think about our incredible time in Rwanda and the unique opportunity I had to meet with some of the local partners that I work with in my network. Some of you joined me. I learned that by including them in this process of network building, they had connected with WHO Rwanda and created a card game that incorporated messages about sexual and reproductive health and rights that they were using in their community. And so my belief holds true even here, even in this fellowship. It's the process of fellowship, the combination of the carefully curated content, the health equity models and leadership models. It's the thoughtfully planned convenings, the spaces that you've provided to allow connections, reflections, not just among our cohort, but even beyond. It's the process of fellowship that for me has been so impactful. So as we continue on our health equity journeys, I hope together we can continue to advocate and champion the importance of investing in process as much as we do in products. Thank you.